All right, so let's have you roll up. All right, we're gonna just keep working on this side. So, okay. So this is gonna be kind of goofy. There we go. All right, and we're gonna get 3/4. So I want you to roll just a little bit more. Now, one of the first things you'll notice is where
What are
he
we
is
working
on the
on?
table. This is still the hip.
I know, but
Yep. So we're starting to clear the two crests here. So we're gonna have him bring his leg back, just like so. Okay. Now, just like we just did before, we're gonna choose 3 positions: 1, 2, and 3. Same positions that we used before, but this time we're gonna do active. So before we did passive, now we're gonna do active. So the 3 points again: 1, 2, and 3. And then the second set of points is going to be around this crest. So again, 1, 2, and 3.
so the first one is the trochanter?
Yep. So right around the
Okay.
trochanter here, and then right around the crest of the alien here.
Okay.
Good. Okay. So the first one is going to be the TFL. So again, we're going to find the TFL, and remember now his leg has shifted, so the angle of that muscle has shifted just slightly as well. So we're going to slide off of it. Let the body weight sink in for the elbow. And again, we're not doing much movement here. We're going to instruct the patient or the client to slide their knee towards their chest 2 to 3 inches. To flex it, and then back down 2 to 3 inches, and then back up 2 to 3 inches, back down 2 to 3 inches. And I usually have him do this between 6 and 9 times. Good. Give me one more. Beautiful. And then come back down. The second one, the second movement is going to be the clamshell. So having him, you can even stabilize if you like, the foot here, just so for the first couple movements, you're going to have them bring their knee towards the ceiling. So they're going to bring their knee up, 1, bring it back down, 2, and then squeeze the knee down to the table for 3. Now the squeeze, thank you, is going to really be where you're going to get a lot of that stretch in, because that's going to be that counter tension. Good. You're going to come back, same thing. So now I'm at that 45-degree angle, and you're going to go ahead and bring the knee to the chest. Back down, back up, back down, and back up again. Good.
So is that about the clients doing 3?
Well, I'm just doing 3 right
Three,
now,
three,
but
three?
I still say between 6 and 9.
Oh,
All depends on how bad it is, right? If
Okay.
you're on the side that's not affected
Mhm.
or less painful, then 3 is pretty much
Okay.
all you need. All right, let's do some clamshells. Up, down, squeeze. Up, down, and squeeze. Good. Again. Up, down, and squeeze for 2. Last one. Up, down, and on this last one, I usually have them hold for like 10 seconds. So squeeze, squeeze, squeeze. Part of what this is going to do is it's going to fatigue out that muscle. So when it really lets go, you're going to get that full lengthening out of it. And slowly release. Good. Last one, you're not going to be moving too much because of the angle, and you're going to lighten up because the muscles here are thinner, smaller. This is also a more sensitive area for some people. So again, last ones, let's bring it knee to chest, back down, and up, and down, and up, and down. Last one, up, and down, and then let's go ahead and butterfly it out. So knee towards the ceiling, down, and squeeze. Good, up, down, and squeeze. Last one, up, down, squeeze and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly release. Good. You can check your work. Everything should feel just a little bit looser. If they were having piriformis type pain, so that pain will travel down the leg if you have that nerve entrapment here. But if you do this technique and they are still having sciatic pain, 9 times out of 10 it's coming from the low back, it's not coming from the hip.
so you mean it's true sciatica?
True sciatica.
Okay.
Right. So, that is the technique.